What if the signs you're ignoring, like shortness of breath, swelling, or nighttime discomfort, aren't just part of aging, but signals that your heart is in distress? Heart failure affects millions of older adults every year. But unlike a sudden heart attack, it doesn't arrive with flashing lights and sirens. Instead, it sneaks in quietly. The symptoms are subtle, often mistaken for stress, poor sleep, or simply getting older. And that's exactly why it's so dangerous. As a specialist in heart health, with over 30 years of clinical experience, I've seen how many lives could have been changed if only the warning signs were noticed earlier. Your heart doesn't fail overnight. It sends out signals early, clear, and actionable, if you know what to look for. In this video, I'll walk you through 13 early warning signs of heart failure. You'll not only learn what they are, but why they happen, how to tell them apart from everyday fatigue or discomfort, and what you should do next. One of these signs. It shows up when you bend forward to tie your shoes, and most people never realize what it means. So stay with me, because the knowledge in this video might not just help you, it could save someone you love. Let's get started. Now, let's take a closer look at the 13 early warning signs of heart failure, starting with one of the most common symptoms that people often mistake for simply being out of shape. Sign number 1. Shortness of breath on activity. When simple tasks leave you gasping. You climb a single flight of stairs or walk to the mailbox and suddenly you're out of breath. If that sounds familiar, don't dismiss it as just getting older. Shortness of breath during light activity is one of the earliest and most common signs of heart failure. I've seen countless patients ignore it, assuming it's due to stress, weight gain, or lack of exercise. But what's really happening is this. Your heart is no longer pumping efficiently enough to deliver oxygen, rich blood to your muscles. As a result, your lungs work overtime, and you feel breathless with even small exertion. This symptom doesn't appear overnight. It builds slowly. People often adapt without noticing, taking the elevator instead of stairs, avoiding long walks, or resting more between chores. But that gradual change in your stamina is exactly what makes it dangerous. The key difference between normal tiredness and heart-related shortness of breath is progression. If you notice daily activities are becoming harder, and you need to pause to catch your breath more often, it's not just aging. It's a warning. Recognizing this sign early can make a huge difference. The sooner we act, the more we can protect your heart from further damage. Sign number 2. Orthopnea. When you need more pillows just to breathe. Have you found yourself needing 2 or 3 pillows just to sleep comfortably at night? That might not be about comfort, it could be your heart asking for help. Orthopnea is the medical term for shortness of breath when lying flat. It's a classic early sign of heart failure that I see often in my patients. And it tends to creep in so gradually that people don't even realize it's abnormal. They just keep adding pillows, or eventually move to sleep upright in a recliner. Here's what's happening. When you lie down, gravity no longer helps your heart move blood upward from your legs and lower body. If your heart is weakened, blood backs up into the lungs, causing fluid to accumulate, and breathing becomes difficult. Sitting up helps relieve that pressure, which is why so many people feel instant relief when they elevate their head and chest. Most people brush this off as a preference or part of aging, but it's not. If your sleeping position has changed significantly over time due to breathing discomfort, it's a red flag. This subtle shift in how you sleep can be one of the earliest clues that your heart is struggling. Don't ignore it. Sign number 3. Paroxysmal nocturnal dyspnea. When you wake up gasping for air. Imagine this. You're sound asleep, and suddenly, you bolt upright, gasping for breath. Your heart is racing, you're panicked, and it feels like you're drowning in air. This isn't just a bad dream, it could be a serious sign of heart failure. This terrifying symptom is called paroxysmal nocturnal dyspnea, PND, and I've had many patients describe it long before they knew they had heart trouble. It typically strikes a few hours after falling asleep, when fluid that built up in your legs during the day redistributes to your lungs as you lie down. If your heart can't handle that extra fluid, your breathing becomes suddenly impaired, and it wakes you up. What's dangerous is how easily this can be misinterpreted. Patients often think it's anxiety, sleep apnea, or even nightmares. But if it's happening regularly, especially if you feel better only after sitting or standing up, it's time to take it seriously. I've seen PND be the first unmistakable sign that something's wrong with the heart. If you're waking up in the night gasping for air, don't wait. That's your heart signaling distress, and it deserves your full attention. Sign number 4. Chronic fatigue and reduced stamina. when everyday tasks feel exhausting. You wake up tired. Climbing the stairs drains you. Even simple chores like carrying groceries or getting dressed feel like a workout. If this kind of fatigue sounds familiar, it may be more than just getting older. Chronic fatigue is one of the most common but overlooked signs of early heart failure. In my years of practice, I've seen patients slowly adjust their lives, avoiding activities, making excuses, resting more often, without realizing their heart is the problem. Here's what's really going on. When your heart weakens, it prioritizes sending blood to your most vital organs, your brain and heart, while reducing blood flow to your muscles and limbs. The result? Constant exhaustion, even with little effort. What sets heart-related fatigue apart is that it doesn't go away with rest. It lingers, grows worse over time, and chips away at your ability to enjoy life. You may also notice your recovery after physical activity takes longer than it used to. If you find yourself withdrawing from things you used to enjoy because you're just too tired, your heart could be struggling silently. Don't chalk it up to age or stress. Persistent, unexplained fatigue deserves a closer look, especially when paired with other warning signs. Sign number 5, swelling in legs and ankles, when your feet tell the story. Have your shoes started feeling tighter by the end of the day? Do your socks leave deep marks on your ankles? These may seem like small inconveniences, but they could be signs your heart is having trouble keeping up. Swelling in the lower legs, feet, or ankles, what we call peripheral edema, is a common early symptom of heart failure. I've seen it dismissed far too often as a result of sitting too long or water weight, but when it's persistent and symmetrical, it's worth paying attention to. Here's why it happens. When your heart isn't pumping efficiently, blood begins to pool in the lower parts of your body. At the same time, your kidneys respond by holding on to extra salt and water, leading to fluid leaking into surrounding tissues. That's what causes the swelling. One way to check is by pressing your finger into the swollen area. If it leaves an indentation that stays for several seconds, it's more than just puffiness. And if the swelling worsens through the day, then eases overnight, when your legs are elevated, it points strongly toward heart-related fluid retention. Don't ignore swelling as a normal part of aging. When your body holds on to fluid, it's often your heart trying to tell you something critical. Sign number 6, rapid weight gain, when the scale reveals fluid, not fat. If you've gained several pounds in just a few days, and you haven't changed your diet, that sudden weight might not be fat. It could be fluid, and that's a key warning sign of heart failure. Rapid weight gain is one of the most measurable signs I look for in patients who are at risk. In fact, I often ask them to weigh themselves daily. Why? Because the heart, when it begins to weaken, sends signals to the kidneys to retain salt and water. This causes fluid to build up throughout the body, often before other symptoms become obvious. If you gain more than 2 or 3 pounds in a single day, or 5 pounds over the course of a week, that's not something to ignore. It often precedes swelling, fatigue, or breathing issues, and it's one of the clearest early indicators that your heart is under strain. You might also notice a sense of bloating or tightness in your clothes, even if your appetite hasn't changed. That's your body accumulating excess fluid faster than it can eliminate it. This type of weight gain is not about calories, it's your heart telling you to pay attention. A scale can be one of the simplest tools for catching heart failure early. Sign number 7, nocturia, when you're constantly waking up to urinate. Waking up once a night to use the bathroom might not raise concern, but if you're getting up multiple times, 2, 3, even 4 times, it could be more than just a full bladder. It might be your heart. This condition is called nocturia, and it's an often overlooked early sign of heart failure. I've had many patients mention it casually, never realizing it was tied to their heart health. Here's what's happening. During the day, when you're upright, fluid tends to pool in your legs. A struggling heart can't circulate that fluid effectively. But when you lie down at night, gravity shifts that fluid back into your bloodstream. Your kidneys, suddenly flooded, start producing more urine, and that sends you to the bathroom again and again. What makes this different from common causes, like age or hydration habits, is the volume and frequency. If you're producing large amounts of urine each time and waking up more than usual, even without drinking much before bed, it's a red flag. Don't ignore the pattern. If nighttime urination has increased without a clear reason, and especially if it comes with fatigue or swelling, your heart may be involved. Sign number 8, nighttime cough or wheeze, when lying down triggers a cough. Do you find yourself coughing more at night or needing to sit up just to breathe comfortably? If so, That dry, nagging cough could be more than allergies, or a lingering cold. It might be your heart. One of the lesser-known but important early signs of heart failure is a persistent cough or wheeze that gets worse when lying down. I've treated many patients who blamed their cough on postnasal drip or asthma, only to later discover their lungs were slowly filling with fluid. When your heart can't pump blood efficiently, fluid backs up into the lungs. This leads to congestion and irritation, especially noticeable when gravity isn't helping you drain that fluid, like when you're flat in bed. Some people describe needing extra pillows or even sleeping upright to avoid the coughing fits. In some cases, the cough may bring up frothy or slightly pink-tinged mucus, which can be a more advanced warning sign. But even without mucus, if your cough gets worse at night and improves when you sit up, don't ignore it. What makes this symptom tricky is that it's easy to dismiss. But combined with other early signs, it could be your heart trying to speak up. Sign number 9. Heart palpitations. When your heart skips, flutters, or races. Have you ever felt your heart flutter unexpectedly, like it's pounding, skipping beats, or racing for no clear reason? That strange sensation called palpitations can be more than a momentary scare. It might be a sign your heart is struggling. In early heart failure, the heart works harder to maintain circulation. That strain can disrupt its normal rhythm, leading to irregular beats or even arrhythmias. I've had patients describe it as their heart doing flip-flops or jumping in their chest, often while resting or lying down. While palpitations can stem from stress, caffeine, or dehydration, they shouldn't be ignored, especially if they happen frequently or come with dizziness, fatigue, or shortness of breath. One common culprit I see in heart failure is atrial fibrillation, a rhythm disturbance that both causes and worsens heart problems. It's important to know that arrhythmias don't just feel strange, they can reduce how efficiently your heart pumps blood, adding even more stress to an already weakened system. If your heartbeat feels off, even occasionally, it's worth checking. Your heart is an electrical organ as much as a muscle, and rhythm changes are often its early cry for help. Sign number 10. Dizziness or near fainting. When standing up feels unsteady. Feeling lightheaded when you stand up or move too quickly might seem harmless. But if it's happening often, and especially if you've come close to fainting, it could be an early warning sign from your heart. In early stages of heart failure, your heart may struggle to pump enough blood to meet your body's needs. When blood flow to the brain drops, even momentarily, it can lead to dizziness, blurred vision, or a sensation that you might pass out. I've had patients tell me they thought they were dehydrated or just tired, only to discover that their heart was the real issue. Normally, your body adjusts blood pressure automatically when you stand or exert yourself. But a weakened heart can't always keep up. That leads to drops in pressure and oxygen delivery, resulting in those sudden spells of lightheadedness. It's especially important to pay attention if this symptom is new or getting worse, or if it happens in combination with fatigue, palpitations, or shortness of breath. Don't wait until you actually faint to take it seriously. If the room spins when you stand, your heart might be struggling in ways you can't yet see. Sign number 11. Bloating, poor appetite, or early fullness, when eating becomes a struggle. If you find yourself losing your appetite, feeling full after just a few bites, or constantly bloated, don't be too quick to blame your stomach. Sometimes, your digestive symptoms start in your heart. Many of my patients are surprised to learn that heart failure doesn't just affect the chest. When your heart weakens, it can reduce blood flow to the digestive system and cause fluid to accumulate in the abdomen. This leads to bloating, nausea, early satiety, and even discomfort in the upper right side of the belly where your liver sits. Your gastrointestinal tract needs steady circulation to function properly. When that flow is compromised, digestion slows down and your appetite suffers. You may feel full after a few spoonfuls, or notice you're avoiding meals because they leave you uncomfortable. This symptom often flies under the radar because it doesn't feel cardiac. But I always remind patients, when your heart can't pump efficiently, every system in your body pays the price, including your ability to eat and digest. If bloating or appetite loss is persistent and paired with fatigue, swelling, or shortness of breath, it's worth looking deeper. Your heart could be behind it. Sign 12. Bendopnea, when bending forward leaves you breathless. If tying your shoes, picking something off the floor, or leaning over a sink leaves you short of breath within seconds, pay close attention. This very specific symptom has a name: bendopnea. Though not widely known outside medical circles, Bendopnea is one of the most telling early signs of advanced heart failure. I first started recognizing it in patients who would casually mention they felt breathless every time they bent forward. What they didn't realize is that this position puts extra pressure on the chest and abdomen, making it harder for a struggling heart to handle blood volume shifts. When your heart is already dealing with elevated filling pressures, bending forward further compresses the lungs and raises chest pressure, limiting oxygen exchange. This leads to a sudden, distinct feeling of breathlessness, one that disappears when you sit upright again. Bendopnea is uncommon in healthy individuals, so when I hear about it, especially alongside other symptoms like fatigue or swelling, it's a red flag. If you've noticed that simple movements like bending forward are making you gasp for air, it's time to investigate further. Your heart may be telling you more than you think. Sign number 13. Cold hands or feet. When your body starts prioritizing survival. Do your hands or feet feel cold even when the room is warm? Do your fingers look pale or bluish, or take longer to warm up than they used to? These changes might seem minor, but they can point to a serious issue. Poor circulation caused by heart failure. When your heart begins to weaken, it can't pump blood efficiently to all areas of your body. In response, your system prioritizes blood flow to vital organs like your brain and heart, reducing supply to your extremities. I often see this in patients whose hands or feet are cold to the touch, even in warm conditions. Another key sign is what's called narrow pulse pressure, when the difference between your systolic and diastolic blood pressure shrinks. This can indicate reduced stroke volume, meaning your heart isn't ejecting enough blood with each beat. Over time, these subtle circulatory changes become more noticeable. Patients report that gloves and socks no longer help, or that their fingers remain cold for hours. It's your body's way of reallocating limited resources, and a strong indicator that your heart is under stress. If you've noticed persistent coldness in your extremities or unusually low blood pressure readings, it's worth having your heart evaluated. These signs are not just about comfort, they're about survival. Now that you've heard all 13 warning signs, I hope one message is clear. Heart failure rarely comes without a warning. The signs are there. The body speaks, we just have to know how to listen. I've seen too many patients wait until they're in the emergency room, short of breath, exhausted, and scared when, months earlier, the clues were already present. A little swelling, a few extra pillows, a dry nighttime cough. These don't seem urgent until they are. The good news? Caught early, heart failure is manageable. We have treatments, medications, and lifestyle strategies that can not only slow its progression, but in many cases, improve quality of life dramatically. But none of that matters if the signs are ignored. If you recognize even 2 or 3 of these symptoms, especially if they're getting worse over time, please don't wait. Talk to your doctor, ask questions, share what you've noticed. And if this video helped you see something in yourself or someone you love, don't keep it to yourself. Share it. You might help someone catch heart failure early when there's still so much we can do. Take care of your heart. It's been taking care of you your whole life.